Hi everyone, have you ever heard about foot drop? What is foot drop? Foot drop is a common and aggravating issue that results in falls and injuries as well as a substantial dorsiflexion, weakness of the ankle and toes. Although anterior horn cell disease, lumbar plexopathies, L5 radiculopathy, and bursitis neuropathy are the most common causes, but there are others. For example, the causes that are not always obvious and the most common is habitual leg crossing, which most patients improve once they cease. Moving on to the incidence and prevalence of foot drop. Now, did you know fibular neuropathy is a condition that has a wide range of documented cases? According to one study, the prevalence is 19 per 100,000 people, with males being more affected than females. It is 0.79 after total knee replacement, with a little male prevalence of 2.8 to 1 respectively. Approximately 90% of the cases are unilateral, both the right and left sides are affected equally. And for your information, there is no incidence and prevalence of foot drop in Malaysia. The etiology or cause of foot drop are the first one is nerve injury. The most common is compression of the peroneal nerve in the leg that controls muscle elevates the foot. This nerve can be damaged during hip or knee replacement surgery. Nerve root that damaged in the spine is called a pinched nerve. Diabetes makes people more vulnerable to disease. Second is muscle or nerve disorder. Foot drop can be caused by a variety of muscular dystrophies, which are genetic diseases that produce progressive muscle weakness. Lastly, foot drop can be caused by disorders of the spinal cord or brain, such as amyotrophic lateral sclerosis or ALS, multiple sclerosis, or stroke. When you are diagnosed with foot drop, these are the signs and symptoms you will notice. First, inability to keep one's shoes on. For instance, walking with a feeling of loosened footwear can cause discomfort and dragging of the affected foot. Other than that is tripping. Tripping can be caused by a lack of strength in the muscles of the foot and toes. Next, falls are caused by an inability to elevate the front part of the foot and toes adequately while walking. Circumduction gait. It is a type of gait that revolves around the body. The leg remains straight and swings to the side in a semicircle to go forward. Limp foot. It's possible that the affected foot will droop away from the body. Climbing stairs might also be tough. Lastly, numbness, loss of sensation may occur on the front and or outer side of the lower leg and or along the upper part of the foot.
The pathophysiology of a foot drop is commonly due to nerve damage. The target and functional integrity of the axon depend on the continued supply of the trophic substance that is synthesized in the neuronal pericardion and then will be transported down to the axon in exoplasmic flow. An injury at the peroneal nerve due to hip replacement will sometimes compromises the exoplasmic flow. The peroneal nerve helps in lifting the foot, but since it is compromised, the muscles that were innervated by it, which are EDL, EHL, fibularis tertius, and anterior tibialis, will be unable to raise the foot, resulting in a distal insult. An injury at the peroneal nerve due to hip replacement will sometimes compromises the exoplasmic flow. The peroneal nerve helps in lifting the foot, but since it is compromised, the muscles that were innervated by it, which are EDL, EHL, fibularis tertius, and anterior tibialis, will be unable to raise the foot, resulting in a distal insult. Next, we move on to the management of the foot drop. There are two types or ways for managing foot drop. It is either conservative or surgical. First, conservative management of the foot drop, which is using brace or splint. A special made or custom brace on the ankle or foot have the ability to maintain the balance, prevent falling, and act as a rehabilitation aid. Besides, a physical therapy can also act as a conservative management to the foot drop patient. The purpose of having the patient to do a physical therapy is to maintain the range of motion of their knee and ankle. Other than that, it is also done to strengthen their leg muscle and prevent stiffness in their heels through electrical stimulation, where the electrodes located under the skin will stimulate the nerve in the foot so that they can contract the muscle and prevent the foot from falling. It is also crucial to do a nerve stimulation in order to improve the foot performance and prevent the foot from dropping. The first surgical management that can be done to a foot drop patient is a tendon transfer. The name of this method speaks for its own explanation, where a tendon and the attached muscle that is still working will be moved from one part of the foot to another part of the foot to replace the malfunctioned tendon. A fusion of the bones is also considered as a surgical method of a foot drop. This method will be done through the fusion of the foot and ankle bones in order to help in stabilizing the ankle. Nerve transfer. The nerve that will be transferred is either the superficial peroneal nerve or the tibial nerve fascicles. This nerve will be transferred to the motor branch of the tibialis anterior or to the deep peroneal nerve. This is to improve the dorsiflexion and the eversion of the ankle. Cause and prognosis of the foot drop. Foot drop that is induced by trauma or nerve injury will usually improve to some extent, if not completely. Foot drop is a symptom of a developing neurological disorder that is expected to be a permanent disability. Impairments and functional limitations according to International Classification of Functioning, Disability and Health (ICF) for foot drop condition. Body functions or impairments. Foot drop patient will experience a decrease in dorsiflexion of their ankle. Activities or limitation. Patient will have difficulty in maintaining their stability during stance and difficulty in walking efficiently. Commonly, patient will experience steppage gait, hip hiking and toe walking. Participation or restriction. Patient will face difficulty to participate in daily routine activities such as bathing and walking. Body functions or impairment. Patient will experience pain in the lower back that radiates to the leg. Activities or limitation. Patient will have limitation in walking and moving. Participation or restriction. Patient will face difficulty to engage in work activities such as teaching and coaching. Body functions or impairments. Patient felt pain with or without numbness in the back of the thigh, side of the leg and upper part of the foot. Activities or limitation. Patient experience difficulties in transferring from one place to another. Participation or restriction. Patient will have problems engaging in functional mobility.
Thank you for watching.